Hey everyone, welcome to another video, and today we're going to continue going over the inferior limb osteology, and more particularly we're going to be going over 4 bones. We're going to discuss the landmarks found on the femur bone, the patella, the tibia, and the fibula. Starting with the femur bone right here, this is the head of the femur bone. Which is located at the proximal epiphysis of this bone. This narrowing right here is the neck of the femur bone. And obviously this shaft right here is the body of the femur bone. Perfect. Now we have 2 large bumps here at the proximal end of the femur bone. There's a larger one here and a smaller one here. The larger one is called the greater trochanter of the femur bone. And the smaller one's going to be the lesser trochanter of the femur bone. Awesome. Now let's go into more detail at the proximal end of the femur bone. Again, this is the head of the femur bone. We have the neck right here. This large bump is greater trochanter. And the smaller one is lesser trochanter. Instead of tubercles like we saw in the humerus and other long bones in the superior limb, the femur bone has trochanters. So don't switch trochanters with tubercles or tubercles with trochanters. Okay? So just remember the femur bone has trochanters, not tubercles, as far as these landmarks right here and right here. So right now we are looking at the anterior aspect of the proximal end of the femur bone. And at this end, there is a roughened line that kind of connects between the greater trochanter and the lesser trochanter. This roughened line, it's difficult to see on real bones, but this line right here is called the intertrochanteric line of the femur bone. Intertrochanteric meaning between the trochanters, and it forms a line. Intertrochanteric line of the femur bone. Now on the posterior aspect of the proximal end of the femur bone, a few more landmarks come into view. On the head of the femur bone, we see a small little depression right here. That depression is called the fovea of the head of the femur bone. Again, here's the greater trochanter and the lesser trochanter. On the posterior aspect, there is some sort of a lip or a ridge right here, and that's going to be called the intertrochanteric crest. Of the femur bone. Also, there's a small depression right here, right up against the greater trochanter. Let me change colors to better illustrate it. Again, right here, there's a small depression only found in the greater trochanteric area. This little depression is called the trochanteric fossa of the femur bone. So on the anterior aspect, we have the intertrochanteric line of the femur bone, And then the posterior aspect connecting the two trochanters is the lip called the intertrochanteric crest of the femur bone. So just remember the lines on the anterior aspect, and then the posterior aspect is the crest. Remaining on the posterior aspect of the femur bone, we have this line. This line right here is called the linea aspera of the femur bone. And it's the insertion point to many muscles, so that'll come into play when you learn the myology of the inferior limb. Moving down to the distal end of the femur bone, remaining on the posterior aspect, we have these two knobs. One right here and one right here. These are the condyles of the femur bone. So on this side, we have the medial condyle of the femur bone, and this one's going to be the lateral condyle of the femur bone. Along either side of them, right here and right here, we have the medial and lateral epicondyles of the femur bone. On the medial aspect of the distal end of the femur bone, just above the medial epicondyle, you'll have this point. This point is called the adductor tubercle of the femur bone. And it's an insertion point to one of the adductor muscles, the adductor magnus muscle. So that's going to come into play again when we go over the myology of the inferior limb. But for now, remember on the medial aspect, just above the medial epicondyle, is the adductor tubercle of the femur bone. It can also be seen in this image right here. This point right here, that's the adductor tubercle of the femur bone. Excellent. We can go ahead and go back to the posterior aspect of the femur bone at the distal epiphysis. This kind of space, this depression right here between the two condyles, this is called the intercondylar fossa of the femur bone, just meaning the depression between the two condyles. This surface right here is called the popliteal surface of the femur bone. And remember, it's only found on the distal posterior aspect of the femur bone. It's not found on the anterior surface. So the popliteal surface of the femur bone is found just above the intercondylar fossa and the condyles of the femur bone. Going over to the anterior aspect of the distal end of the femur bone, again we see a few landmarks that we already know. We see the adductor tubercle right here. We see the medial and the lateral condyles. And we also see the epicondyles, lateral and the medial epicondyle. However, we have this different surface right here. This surface is another articulation site for another bone. This is called the patellar surface of the femur bone. Of the femur bone. This surface articulates with the patella, which is actually the next thing we're going to go over after I finish up the last landmark that we need to know in the femur bone. Remember how we talked about nutrient foramen and how it allows vessels to go into the bone to supply nutrients and exchange waste? These little holes right here are actually nutrient foramen, and they're quite visible, especially on real bones. So just remember, these little holes are nutrient foramen. And that concludes all of the landmarks found on the femur bone. It's not too hard or complex. A lot of these landmarks are landmarks seen on other bones, but remember, we just got to parent it to the right bone. Like the condyles, we found there's a condyle in the humerus. We have condyles here on the femur bone as well. So just remember to parent correctly. Now we can go ahead and move on to the patella. So right here we have a patella, and there's only 4 anatomical landmarks that we need to learn on this bone. The first one being this portion right here. The superior portion of the patella is called the base of the patella. Now this very pointed area, this is called the apex of the patella. Now we're looking at the anterior aspect of the patella, meaning this surface right here is the anterior surface of the patella. And the last landmark that we need to learn for this bone is this surface right here. This surface is called the articular surface of the patella. And it's called that because it articulates with the patellar surface of the femur bone. And those are all the landmarks we need to know for the patella. We can go ahead and move on to the tibia. This is the tibia. It's not called tibia bone, it's just called the tibia. The tibia is unique because there is no head located at any part of the bone. So this is one of the few long bones that doesn't have a head on it. Starting at the proximal end of the tibia, we have a few unique characteristics seen here. Just like the femur bone, the tibia has 2 condyles located here. These 2 knobs. And they are the medial and the lateral condyles of the tibia. Between these 2 condyles, we have 2 pointed projections coming off right here. These are called intercondylar tubercles, and they're named by the lateral and the medial sides. So this one right here is going to be the lateral intercondylar tubercle of the tibia, and this one's going to be the medial intercondylar tubercle of the tibia. Between the 2 tubercles, we have another region where this kind of star is. This region is called the intercondylar eminence of the tibia. And again, this is located between the 2 tubercles of the tibia. Between the 2 condyles on the anterior aspect, right here, this region is called the anterior intercondylar area. Of the tibia, and on the posterior aspect in this region back here, that's going to be the posterior intercondylar area of the tibia. Now again, this is an anterior view of the proximal epiphysis of the tibia, so let's go ahead and look at the posterior aspect. We can see again the medial and lateral condyles of the tibia. We can see the medial lateral tubercle, intercondylar tubercles of the tibia, and then we see this little space in between them, which is the intercondylar eminence of the tibia. This region right here, this little box, that's the posterior intercondylar area of the tibia. Now we can go ahead and learn a new landmark, which is this one right here. This area right here is called the fibular articular surface of the tibia. As the name suggests, this is the area where the head of the fibula articulates with the tibia, right here, in the fibular articular surface of the tibia. You can also kind of see a line that courses down the posterior aspect of the body of the tibia. This line is called the soleal line of the tibia. And you'll learn more about why it's called soleal line when we go over inferior limb biology. Okay, and I almost forgot. We have one more landmark that we need to cover in this image over here. And it's this one right here. This bump, a little bit lower than the anterior intercondylar area of the tibia, is a roughened patch, and it's also a bump, and this is called the tibial tuberosity. And that concludes all of the landmarks found on the proximal end of the tibia. Now we can go ahead and move our way down to the distal end. The distal end doesn't have too many landmarks. There's a little notch right here, and this notch is called the fibular notch of the tibia, because this is where the fibula kind of fits right in. This little projection right here is called the medial malleolus of the tibia. The medial malleolus is actually a landmark that you can palpate on your own foot. It's on the medial aspect, and it's that bump that sometimes gets kicked when you're playing soccer or in some other sport. That is the medial malleolus of the tibia. And the last landmark that we're going to learn on the tibia is this one down here. This is a surface called the inferior articular surface of the tibia. And those are all the landmarks that we need to know for the tibia. We can go ahead and move along to the fibula now. The fibula is a long, narrow long bone, and it looks pretty plain and simple. And there aren't too many landmarks that we need to know. Starting at the proximal end of the bone, we have the head of the fibula. This very pointed area right here at the very tippy top, that's called the apex of the head of the fibula. And of course, this narrowing right underneath the head, that's going to be the neck of the fibula. This diaphysis is the body of the fibula. And now we can go ahead and zoom into the distal end of the fibula. This distal end has a few landmarks that are quite unique. This whole distal end of the fibula is called the lateral malleolus of the fibula. And it has a few landmarks. This whole surface right here is called the articular surface of the lateral malleolus of the fibula. It's quite long. Remember to parent it back to the fibula. There is a small depression found right next to the articular surface of the fibula, or the articular surface of the lateral malleolus of the fibula. And this depression is found right here. And it is called the fossa of the lateral malleolus of the fibula. And that's it. those are all the landmarks found on the fibula. Again, we can quickly review since there aren't that many. We have the head of the fibula, we have the apex of the head of the fibula, we have the neck of the fibula, then we have the body of the fibula, which is the whole shaft or the diaphysis of this long bone. Then at the distal end, this whole thing is called the lateral malleolus of the fibula. And on it, on the medial aspect, we have the articular surface of the lateral malleolus of the fibula, and the small depression found on that is the fossa of the lateral malleolus of the fibula. And those are all the landmarks found on the fibula, and that concludes this video. I hope it was helpful, and I'll see you guys again next time. Take care.